So the main purpose of the trips to Minnesota, especially going to the IHS sites and the different reservations, is mostly to get exposure to medical students, for people who are interested in working in those areas. A lot of people come to med school and might not have ever lived in a rural area or treated a patient population that's rural or native. And so it's a good idea in medical school to get a kind of a glimpse at if you would be someone who would be willing to and would be good at working with those types of populations.
I think people come into med school thinking, this is what I want to do, or maybe they don't. Maybe they have no idea the type of community they want to serve in. But going on a trip like this, where you get such exposure to marginalized communities, you really get a sense like, is this how I want to serve as a physician? And a lot of people come away from the trip thinking, yeah, I do want to serve on a reservation or help in tribal health in some capacity as a physician. So I think that's an excellent thing to bring awareness to students and drive them to help Native communities in the future.
I went into this trip knowing that it was just another way for me to experience hopefully what my future career will be like. And so I kind of already had a little bit of an idea, but every tribe is different, especially, when you go from Oklahoma even to the Northern Plains. The tribes are much different in the way that everyone interacts. I felt like I was able to kind of understand a lot of their culture and was able to connect with them more. And there was actually a lot of people, the Creek and Seminole Nation have a lot of crossover in terms of their members. And there was actually a lot of people who I met there who were part Creek and were from a very similar tribe to one of the parts that my great-grandmother is from. And so I met a lot of people who had lived in the same areas that I had growing up, which was actually very cool.
We don't know what we don't know. And unless you are exposed to how complicated these systems are and how racism has played into the destruction of Native lives for centuries, you're not going to understand what generational trauma is or how that informs the health of Natives across the US. So even just a slice of that, getting just a week of that, is so important for us. And I really do think that students come away with the knowledge that, yeah, I didn't do anything to help actually, but I learned so much. And now I have a better understanding of what I can do going forward to maybe combat some of those societal systems that are so unjust and oppressive in this country.